Okay, you're welcome back to this session on decolonizing health journalism in Africa. And it's a panel conversation that has been holding by the fellows of the Africa Disease Reporting Fellowship that has been holding here in Abuja, Nigeria, with the sponsorship of the ADReF, an NGO that has been doing a lot in research and disease prevention. My name is Odo Diego Kenyodo from Akweya TV, and I'm also part of the faculty on this fellowship. For this session, we are having an interesting conversation about how we are going to prioritize indigenous knowledge, health knowledge, and indigenous ways of making meanings, indigenous ways of interaction. How do health journalists in Africa ensure that this is brought to fore in the future of health journalism in Africa? So in this panel on decolonizing health journalism, I'm going to call the moderator of the session, who is a professor of development, theater for development and development communication. He has a lot of history going with him in Africa and different parts of the world in terms of mobilizing communities and using indigenous knowledge. Please join me in welcoming Professor Oga Steve Abba to the panel. You're welcome, sir. So, and the fellows that are going to be on this panel, as you saw on the other panel, it's all fellows speaking about their experiences and the future direction as a result of the fellowship. The fellows that are on this panel are going to be Jean Dodo Ndikumasabo from Burundi. Please a round of applause for him as he comes up. Yeah. If I didn't get that name right, that's one of the learning experiences in the Kumasabo. All right. And from Nigeria, we have Nena Jane Ibe, a health journalist who has also done a lot in print, online, and you're going to hear a lot from her in her perspectives. And from also from Nigeria, Obo Agbonkese, whom all the fellows have decided to call head boy. Please give him a round of applause as he comes over. Well, for obvious reasons. He always does not fail to add for obvious reasons. What's the obvious reason? And we also would have on this panel from Kenya, Milian Njeri Murigi. A round of applause for her. And those fellows and panelists and who are not panelists, please, you can move forward. Just let's fill up these spaces in front, and then we'll let the conversation begin. I hand over to Professor Abba.
Thank you very much, and let me welcome all the fellows to this panel. This is a panel which I'll prefer to call it a panel of looking at issues of inclusion. You know, the word participation and inclusion are the trending words in development, whether it is in the health sector, whatever sector it is. The question and concern for participation and inclusion is very high. And in thinking inclusion and participation, I'm also going to be interrogating the fellows on their knowledge, what they have gained, and also to talk about the issue of the narrative of singularity. The narrative of singularity versus complementary narratives. I think that's what we should be talking about when we're talking about health journalism. So, let me begin by asking the fellows, What is our own, or what's your own understanding of the diversity of health practices in different parts of Africa? Any one of you can start. What is your own understanding of the diversity of health practices in Africa? You are holding the mic, Jane, so you may as well start.
To my own, good morning, everyone. To my own understanding, health practice in Africa has actually, how do I put it, has actually been on a diverse, you see Africans not coming together to be able to fashion out what we want for ourselves as a people or as a continent. A little bit of it was even when we had the Ebola crisis. You could see people, that was for the first time where we saw people try to do things together, share experiences and learning processes, and you find people trying to make sure, oh, what is it that you in this country has done differently? How do we assimilate this, or how do we adopt this to infuse into what we already have in our system? And after Ebola, I don't think I've seen much of that happening more again. At this point, I expected, or rather we take to, fly out our best hands out of the country, or rather our best hands get out of the country and go to the western parts of the world, some of the things which we are actually speaking against right now. I think it's time for the Africa people, African scientists, researchers, and health professionals to be able to work together, have exchange programs, so to say. I think I see that in the education sector. There's exchange programs between, I think, the Rwanda and the Nigerian government. That could also happen in the health sector, where you have professionals, taking what it is that we have, let's say, for instance, in Nigeria, and we take it to a place, say, like Rwanda, Burundi, and then we share amongst ourselves. And in that case, we bring about diversity. Then you can look at what we have on ground and say, this is what this person has been able to do, and this is why it worked for him, probably because of their geographical makeup, or probably because of what they eat. So how do we now get these things to our own space and make it work for us too? I think for me, that is actually what is key in all of this, because when we talk about finding African solutions to African problems, it's high time we stop, looking out away to the West. It's time we start looking within ourselves to say, this is what worked for Nigeria. So Nigeria, what did you do? How much did you spend? How were you able to, do these things? Who did you get involved to form a committee that was able to give us such a beautiful outcome? And then so that we can see what we have on ground in Burundi, for instance, and see how that works for us.
Okay, my answer to this question, diversity. From diversity, I understand the inclusion. To include when it is a matter to find a solution, of health issues, to include communities, to include participation. They can contribute to give a solution. Thank you very much.
I want to speak to it briefly politically, because the diversity we have is political. Otherwise, the average African does not have problem with the other man across the border that was created politically. The point I'm making is, if we are tackling a disease in Africa, if it's affecting the elite, that is when you see them come together. An example is COVID. Because COVID didn't discriminate between the rich and the poor, that was how it worked properly in Nigeria, the containment, the control here and there. It is the same thing if we extend it to the African continent. Why, for example, does Francine need visa to come to Nigeria? So if that kind of barriers are there, then there will always be different ways of tackling diseases that could have been tackled better together. It extends across, everything, that affects everything we do. If we even want to go across to international waters, how did it take so long to talk about the vaccine for malaria? Because it's not the problem of the West, it's our problem. We couldn't tackle it here in Africa because of this diversity that was created artificially. Meanwhile, at the communal level, we know how to tackle malaria, we know how to, even prevent it. We have leaves that when you cut them and put them in the room, mosquito will not come near you throughout the night. But we tackle these things differently and we have no solution until the West is not coming with vaccine. And we don't know what the vaccine is going to leave behind in our bodies.
For me, diversity, I would say, is accommodating each and every person who is working in a healthcare setup, accommodating them, all of them, not only to ensure that every person that is in this sector is recognized.
Okay. We are talking, from what I'm hearing, collaboration beyond borders. That's one area that everybody is suggesting should happen. I'm also thinking, in addition to collaboration between borders, that most of the fellows, the responses they are giving, is about collaboration of existing modern medicine. How about indigenous medicine? Has it been demonized? And are journalists complicit in this demonization? I ask this because how well do journalists cover the practice of indigenous medicine in their countries? Are you complicit in their marginalization and refusal to include them?
I would say yes, journalists have been part of what is happening, but I think it's because our politicians or those who are in charge have shown us this is not the way we are supposed to go. We are supposed to go this other way. We are trying to move away from the traditional medicine, and we have embraced Western medicines. So even journalists have moved away. We are even not giving attention to the people who are working with herbs and everything. We see as if they are not part of the medical practitioners, yet they play a big role in the health sector. But I think something is changing with policies, registration of these people, now having associations and them coming together to show the public that we are doing something, we have solutions, and these solutions are better than whatever you are given by the global north. I think something will change in the near future, if not today.
Before I demonize journalists for demonizing traditional medicine, I want to start with a caveat. I think a lot of burden is being placed on journalists and journalism. The society is going bad. They say journalists were not doing our work, we are not exposing them. A politician is stealing us blind. They say journalists, you praise them too much. I hope this will change with time. Having said that, I want to agree that we are complicit in demonizing traditional medicine. Because one, again, system failure. The average journalist does not earn well. And you expect him, from the meager salary he's getting, to go and report how well an old woman is curing headache with a simple something you just rub somewhere in the head. It will cost the journalist a lot. It will cost, time, and then the journalist is expected to beat deadline with a particular bit or report he or she has been assigned to. That's that for that. But we have a duty to report traditional medicine, how they work. The only thing we can do based on this kind of education, enlightenment, exposure, and the rest is discuss how the rules of administering this traditional medicine can be codified, and then discuss how possible is it to calibrate the therapy. Then again, the West is taking over. There are Western companies now, Asia or Japan, who are putting bitter leaf into tablet form, and then they're bringing us back to us to buy. Meanwhile, when I know myself, when I feel I've taken too much sugar or I've not taken vegetable for a long time, which means there's going to be a problem with my system, digestive and the rest, I just pluck a branch of bitter leaf, wash it, and then chew like 10 or 20 leaves raw. And I know it cleanses my system. In fact, if you can try it individually. Wash bitter leaf, the water, take it consecutively for 3 days. It might drain your blood after draining all the toxins in your body. So we do not, we do not.
It will detoxify you, not drain your blood.
After detoxifying, if you continue to drain your blood. I'm just trying to point out how powerful these herbs are. But then journalists, we are not doing enough, to do it. But then we exist in a system that does not empower us.
We were talking about stories for each of the fellows. This is probably an area that journalists and fellows should think about a story. Agbonkese, you have a personal experience with the herbs. Why don't you profile one of these stories? The village medicine man, and show the world that there is value in this kind of practice. Because the stories are many. The story I told you yesterday that the late Professor Shotimayin told me, it tells volumes about what exists that have not yet been explored. And that's why we are having this kind of discussion. Jane.
This is a panel, and then I also believe it's a place for us to also bare our hearts, right? So I'm using this as a caveat like my brother did. One, I think, like he said, the system has gone bad, right? But most importantly for me, what I think here about whether journalists are complicit or not, yes, I am. Yes, I am. One, because I think it's a triad. One, there should be belief, and then trust, and then possibly advocacy or communication or enlightenment, fine? So if I'm going to go to the herbalist in far away Osun State to take a herb, I, Nenibe, should actually believe in what she's doing or he is doing. And then I should trust the process. When I talk about trust, I'm talking about what quantity am I supposed to take. For belief, it's about if you give me 10 pieces of bitter leaf and give me paracetamol to chew, which one will I take? To be frank, I will take paracetamol. That's the truth, because I want it easy and I want it not too bitter to be able to, assimilate and all of that. So I think the thing we need to do amongst ourselves first is to change our mindset, to begin to change our mindset, to believe that these things are okay and they could also work. That's the trust process. And then you start talking about advocacy. It's until I have believed and trusted the process that I can be able to authoritatively tell someone else in my story that this has worked, this is what it has done. Oh, I even tried to take this. And then you see me becoming an advocate of this particular process. So I think it's also, I want to believe that this fellowship is also a platform or a ground for us to be able to now know that, okay, these traditional medicines, I mean, it's working. You don't see a woman because she's not so, fly and all of that. You don't want to see or get details of what she's doing or he is doing. You have to try, oh, how has this worked? Who and what, who? Can we run some tests? Or how do you know that what you even administered to this person is what has worked for him or her and he's getting better? And as such, we'll now start looking at even the medical practitioners amongst ourselves. What support are we giving to these people? Our scientists, what support are we giving to these people, the traditional medicine experts, so to say? And then before we now start talking about government policies, where the politicians and the government, the lawmakers come in. So it's after we have gone through all these processes that we can start talking about policies and laws and controls for these traditional experts, medicine experts.
So part of this is self-sanitization in terms of, do I want to listen? Do I want to believe? Do I want to try? And it's about opening one's mind and learning new things and probably saying, let me either unlearn or put on hold for some time some of the things that have been driven into my brain from primary through to university and see where I'm coming from. One of the things that interests me a lot as a teacher for so many decades is when I see very young people come into the university. They have come directly from their villages and they know nothing and they are excited about being on campus. 2 years down the line, when you ask them to go and do their community theater, which is one of the flagship programs in the university where I was, and they look at you and say, me, go to the village. So they are committing class suicide because they have moved from that village level to a new level. And that affects how they assess and appreciate what exists in the very place they grew up in. And I think it's possible that some of the journalists may be caught up in this transition from I'm no longer there to this is where I am. And that's maybe what drives complicity of journalists in investigating some of the relevant issues in rural communities. Ndema Kusabo, or what is it? I'm turning the thing around. Ndikumasabo. Yes.
Thank you very much. Before giving my answer, if I'm complicit or not, I want just to give a small testimony. Okay, in 2022, my little brother was in university. He was preparing to do his final exam, and then she called me and say, "My brother, something is killing me slowly, but I don't know what." And then after we go to the hospital, they begin to think that it is because he worked too much. It is he's tired, or she's suffering from his eyes, and then it would be better to change his glass so that the situation can be improved. And after they gave him some medicines, they changed glasses, and then we go back to home. After he told me, "Please, my brother, I'm dying. Something is killing me slowly." And then we go back to the hospital, and then they ordered him to go to check up if it is diabetes. And then we went there, and after they find that the glycemia was at 18.3, and then they told me, "Don't go back home. You have to go immediately to the hospital. They can treat him because he can die." Okay, I go to the bank. I withdraw money, and we prepare to go to the hospital. On the way going to the hospital, I met a practitioner. He asked me, "Where are you going, my friend? This little brother of mine, is suffering from diabetes." And then they ordered me to bring him to the hospital so that they can treat him. And He told me, don't go there. I asked, why? Don't go there. I want just to help you. No, you are lying. I want just to help you, and then I don't need money. No, come on. How? Okay, let's go back home. I, my little brother, and the tradition on my home. He began to tell us what we can do. Take this, take this, take this. And since here in Bujumbura city there is a bush, call at home. Ask them to go to the bush, take that vegetable and send. Okay. I call at home in the countryside. Go to the bush, took this vegetable, took this one, took this one, took this one, and it just sent. After I called the Tadi petition, my friend. Vegetables are now at home, and he came. He told my little brother, take this, take this, take this. In the morning, in the evening, take this, take this, take this. After 2 weeks, you have to go back to the hospital to do a checkup. And then, after 2 weeks, I went with my little brother to the hospital. They did the checkup. They found that diabetes was at 15, and he continue. Maybe the situation will be improved. After 2 weeks, we go back there. And that moment, a doctor find that the diabetes was at 13. Okay? Go. Doctors ask it, what kind of medicine are you taking? Did you go to the hospital? I said, no. I didn't go to the hospital. My little brother is taking vegetables. He looked at me and said, are you foolish? What are you saying? My little brother didn't go to the hospital. He's taking vegetables, being at home. No, I don't understand. So, after we go back to the hospital, and then doctor found that now the glycemia is stable. And then he told to my little brother, go and continue and eat everything, sugar, everything you eat, drink everything with sugar. Now, after two months, you will come in order to check if glycemia is always stable. I said, okay. My little brother began to eat everything, sugar, everything. He eat everything. And then after 3 months, we went back there. They found there that glycemia is always stable. And then go. He told to my little brother, go and continue to eat everything. Now you are okay, you are well. So now after this fellowship, something is asking me why I didn't write a story as a journalist about it. Why? I didn't think about promoting this tradition. Yeah, to me that as a journalist, sometimes we are complicit. Yeah, we contribute. There are many traditions who can contribute because it is a contribution. It is not only the Western who are able to contribute about African health. Tradition communities can help, but we are not promoting, we are not take out this knowledge about tradition as a journalist. Thank you very much.
Thank you, Ndeko Masabo. This is another story of how indigenous medical practice can be useful, can be effective. I'll tell you a story very quickly. In the university where I work, one of the most famous structures is the drama village. And in the drama village, we have a gardener and caretaker. His name is Mike. One day, Mike ran to all of us who are staff and said, I need money to go and do tests at the teaching hospital in Jos because Ahmadu Bello University in Zaria didn't have the facility. I said, what's the test about? He said, he has hepatitis. And we donated money. He went to Jos, did the test, and they confirmed he had hepatitis. And he was going to the hospital. I had a friend who was studying for his PhD in finance, somebody from Ogun State. And we were talking about this gentleman and a whole lot of other health issues. And he said, did you say the person has hepatitis? I said, yes. He said, come. He took me around the university and we found one small shrub. He said, this is the medicine for hepatitis. I said, how? He said, okay, the guy should collect the leaves, blend it, add a little milk, drink in the morning, drink in the evening. For a month or so, he will see a difference. I said, okay, I told Mike. And I got the herb, planted it in a flower pot in my house, and it started growing very rapidly. And I was harvesting it and giving to Mike. And Mike also grew it around his house. After 2 months, Mike went to the hospital, did a test, and they asked him, what did you do? He only smiled. And the story started going around that I was curing hepatitis. And one fine morning, one gentleman knocked on my door. He had a big bag. I said, what's the problem? He said, the wife is suffering from hepatitis. He hears I can cure it. So he came with this bag to collect the leaves and all that. I looked at the bag. I said, is that why you came with this big bag? He said, yes. I said, I don't cure hepatitis. But I do know something that a friend showed me. Look at them growing around in my house. Harvest them as much as you can. And I told him what to do with it. And he went and started giving the wife, and the wife improved. That herb is what many Nigerians call stonebreaker. The scientific name is Nururi, what's the other name? I'll remember the name, so that you can Google the name and see it. Nururi philanthus. If you Google Nururi philanthus, you will see it. And I also was doubtful. I called one young man in biological sciences to my house. I said, look at this leaf. He plucked it, went, Googled it. You know, there are apps on your phone. You take a picture of the plant and it tells you what the name is and what it can do. And the young man did that. He ran back to the house and said, in addition to hepatitis, this herb is very useful for diabetes. And I started telling people, I said, well, at least in terms of the dosage that my friend gave to me, that's what I announced to people. And I saw clear evidence that this thing works. I know that the challenge is sometimes is how much should you give, at what regular interval and all that. That is still in process of being understood, and I think this is where the collaboration of the two sciences need to come together. And I call it two sciences, the traditional science of medicine and the modern science of medicine. What will you do, or what can we do as journalists, as people who engage in knowledge promotion, to bring the two sciences together?
For me, I think what we need to do is what you've just said, collaboration. I mean, like, we need to break that barrier where one thinks is better than the other and things like that. Collaborations that would bring them together. What do you know? And how can we make it better? Fine. The modern scientist has gone haywire in science and tech and all of that. So we have to now look for platforms where we can bring both together. You bring your technology, your modern science, and then, you bring what you know, and then we look for ways to make them easy and reachable to people too. Again, secondly, what the journalists can also do in this regard is, journalists are not spirits. We are not ghosts. We don't know unless we're told. Sources are human beings, really. So if you want this thing out and you want a journalist to know about this, in this collaboration between the two sciences that you've mentioned, journalists should also be incorporated into the system. I went for a meeting on Friday, and while we were having discussion, there was the FIRS. I'm just trying to digress a little bit. There was the FIRS, there was the SON, there was the Vice President's Office for MSME and all of that. And I looked at the committee that they were having. There was no media person in the committee, and I asked the question, you guys, in all the beautiful, recommendations and the communiques you produce and all of that, when you're done with all of these things, what happens to it? You come around, you start begging me. And because you're begging me, if I have the chance, I will do it. But if there are bigger stories and they say, yes, Mwike is fighting with Fubara, I'll go for that first before I start thinking about your own. But when I'm in your midst, I'm part of the system, the obligation is on me to make sure that it's not just me putting out your stuff. I look for colleagues who are also in the same field, or who I know can be able to handle these stories and make sure they also help. Guy, I beg you, help me, and my committee be this, and they would do it. So I think in whatever it is that you're doing, in conferences, in your research work between the both scientists, the media people, there should always be a media representative in the committee, in the system, in whatever. Make provisions for media to be part of what you're doing, and that way media can be able to take out the story in a story format, in advocacy format, in jingles or whatever, even opinions. if, for instance, I come to a medical practitioner and go like, oh, I'm writing on tuberculosis, I've done a couple of things on tuberculosis, please can you help me with an opinion on tuberculosis? You're the experts. I mean, you will chase them from now till the next 1 year. You've not gotten them. They won't write it for you. But this is your niche. This is your forte. You should be able to give me, no matter what it is, 500 words. Sometimes we don't even require so much. 500 words, 600 words, I'm okay. And then I can also fine tune where the need arises to, make it better.
Thank you.
Okay, thank you very much. In this case, as she said, we need to shed light on collaboration. We need to leave no one behind. No one behind, because everybody can contribute in his own way. Tradition, moderns, if it is the case of contributing to tackle or to counter the health issues, it is important to leave no one behind. Thank you very much.
Auntie, you're very selfish. You're asking for 500, 600 words. For SEO, 300 words is enough. Yeah, 200 words are enough. And that's just by the way. A very simple way we can get this going as reporters is if we are writing a story about a particular disease or a particular cure, there's this tendency to go for health experts, say gynecologists with many years of experience, like that. Each time you go for that kind of expert, balance it off. Let us balance it off by also seeking the opinion of a traditional medical expert. That's one way of getting them together. So when that doctor or that expert is seeing what he said, he might also read and see this person and say, okay, this can be true. I might be even forced to react. That aspect also person said, I don't agree, but like this, something can kick off from there.
For me, the answer is simple. It's about telling the story. But now the hindrance comes in. I am able to tell the story, but my media house doesn't buy into that idea of telling that story. There are some media houses that don't allow any story about, for example, any story about GMOs, simply because they will be seen as if they are promoting GMOs. This will be the same thing that will be happening with herbal medicine or traditional medicine. They don't want to be seen as the promoters of traditional medicine. So I think apart from telling the story, we also need to change the mindset of the media owners, because they are the one who control the media industry. That is it.
This is the question of educating the oppressors. Because the media owners, the government officials, are the people whose mindset need to change. And it looks to me as if there has to be an internal movement amongst the owners and journalists, how that will be promoted for them to come around to a new realization. I'm not quite sure. But I think that's something that the fellows here can begin a debate on after this fellowship. We are talking about inclusion and participation. We have only 3 minutes so that we can leave the rest of time for questions from the audience. But the last thing I want to ask is, what is the mode of communicating with these indigenous practitioners? Because we're talking about, we must include them, must carry them along. Many of you are operating at cyberspace. Is it available to them? What mode of communication and journalism will not leave them behind, will bring them in? Let's, very short answer so that we can open up.
I think this is where most of our radio colleagues come in too. And then again, in any way we can, I always tell colleagues, younger colleagues, I tell them, whatever you do, leave the ambiguity somewhere else. You know, when you're writing to the technocrats, it's fine. You can play with your words and make it so flowery and all of that. But in your stories, make it as simple as possible. If there is need for you to infuse Pidgin English, that's perfect. I write my stories and I write in Pidgin, and then I can actually come and put it in a bracket. This is the English, you know, or this person speaking in Pidgin said, you write it there. If this person spoke in Igbo, give them that liberty to, you know, speak their local languages. And then, in fact, there's something someone taught me in photography. If you're taking a picture of a child, there is no need standing. That child is already, you know, you come down. You should be able to, yes, you should be able to come down to the level of these people. So language matters. Let's come down to their own languages. Where it's not possible, as a journalist going into the field, you look for fixers and make sure they are also, and then dressing also too, especially when you have to go into the field, you dress like the people. Try to, you know, accept whatever it is that culture-wise and all of that.
Key in communication to certain groups of people. I mean, in fact, not to everybody. I mean, when they invite you to Aso Rock, they expect a dress code. And if you go there differently to that dress code, maybe the person at the gate will say you cannot enter. It's the same in indigenous societies. There are certain things that we condone. And I mean, we tell our students when we are going for community theater project, don't wear trousers.
In my article, some videos and some subtitles, so that this community I'm serving understand why I am here. Thank you very much.
One thing we can do is what Justina and her team, what they are doing, advocacy, boots on the ground in the factory, not just sitting up behind the camera or writing in the paper. Get message down to them. You can easily know what they want and, you know what you want to give them. Reinterpret things for them. Another thing is, where's the brother from the north? He said something about Dubawa. Once in a while, they do some advocacy. And we're aware that on sites, they allow you, they have a section where you can choose the language you want to read. With multiple languages are there. That's another way, to go about that. And then, as I've always stressed since we began this fellowship, there's a need, like she pointed out, to orientate the mindset of the money bags, the ones that make the call. You need to let them know this is what is actually happening. And you can still make money from there. Because all they want is views. For those publishing digital space, they want views. So you have to do what is trending. Google trend, what people are asking, you have to do that. But also, you can convince them that there's money to be made, with this kind of story that's want to bring in the African story, the African perspective.
I think if one is doing anything to do with community, you have to involve the community. Let the community be there. Let the story be delivered in a way that they can understand, and let them know this is part of them and it is not what you want to pass across. So I think the best mode or the best, every format that is used for news media is good for passing this information, but always work with the community and work in a way that they understand what you are doing.
Thank you. The last session, somebody talked about community radio, bringing communities into the space so that they can be part of the discussion, they can be part of working out modalities for communication on issues that affect them and so on. So it's a toolkit. You have to develop a toolkit and pick from that toolkit what is appropriate depending on your context and how you will handle it to achieve impact. I think at this point there may be one or two questions so that we don't just go away without answering any questions. question that will come from the floor. So, any question? Yes, please.
So it's not like a question. It's in addition to the part of inclusion. I want to emphasize on community engagement. As journalists, we need to start looking in that way, because I personally have actually observed that it has helped me, especially when I'm trying to spotlight stories in rural communities. Yeah, as journalists, we like to have contacts of influential people. We want to have contacts of the high GP of police. We want to have contacts of the SSA to the president and all. But then how many contacts of obas, community leaders do we have? We have community development initiatives. How many of that contacts do we have? I remembered a time I had to go to a particular community, Akute, in Ogun State. Fortunately for me, I walked in at a time when they were having their community meetings, where they had their chairman and all. So I was actually skeptical at the point that why will I have to address them? Because the leader was like, you have to, introduce yourself, do this, do that. And then that was like the best thing I did, because it helped me get certain information. In fact, the story of that community was actually one of the lead, to the story I did. So community engagement is very important. Trying to have contacts of, rural leaders, it will also help us to disseminate information to them.
I have a question, also I have a point to make as it relates to how we can be able to do trust building between scientists and herbal healers. So I think what has happened is we as Africans renege on our own responsibilities of trying to harness our own potential. Like you made reference of the leaf that was used to relatively calm down hepatitis, because whether it killed or it was not killed, but the disease was not seen in the individual anymore when scientific test was conducted. So did we as in the African medical field take interest in trying to do it from the African perspective? Maybe what are the side effects, what are the quantities that should supposed to be taken? Let the dot to see how we can be able to harness this as our own, outside of the one that goes to the pharmaceutical companies. That's one point. My question is, we're talking about trust building, right? How can we, as media people, how can we be able to portray the efforts of herbal practitioners to promote herbal treatment, since indeed we already know that medications come from herbs. It comes from trees, it comes from leaves and so forth, but it's the same leaves that the herbals are using. But we are depending on these scientific researchers and we promote them, but we fail to promote our own locals who are doing some of the amazing jobs. Imagine someone got a fractured leg and he doesn't go to hospital, but he goes to a herbal doctor and his bone comes together as normal as it is. So how can we be able to push them at a certain level as journalists?
Good afternoon, panel. Listening to all of you and to the panel that has gone before, and I do not recognize the Africa you are talking about. I'm totally alienated from the sense of it is my community, it is my people, it is my family, it is my blood, it is my DNA that you are reporting about. I get this sense of an Africa that is like a ship that dropped from space and you're encountering it for the first time. So there is no empathy. There is no sense of, I'm talking about the thing that resonates with my essence. And I do not blame any of us. We're all reacting to the fact of what colonization has done to us, which is to disenfranchise us from our very roots. All of these things that we're talking about, be it in terms of medical reportage, be it in terms of dietary preferences, be it even in the form of the name that I bear, we are all strangers to our Africanness, and that's the truth. So we are trying to rediscover, we are all in the process of decolonizing ourselves. So if we do not start by engaging with who we are, we will not be able to report ourselves with the right prism to the outside reader, whoever that outside world might be. We are looking for validation from the same people that have rendered us into disillusioned beings, all of whom are aliens in their own home environment. It happens everywhere. I'll share my story. I was privileged in the course of my career to handle a national assignment. We were creating a carnival for Nigeria for the first time, and I was on that team. Oga Yerima was my boss for that assignment. And we thought we had delivered perfectly well on the task that we were given. Except that when I had to write the report, because I was heading the secretariat, and I had done marvelous documentation in terms of picture coverage and everything, I was asked, where are the Uyibos? The white people. Sir, don't worry about it. Everything that I had done did not measure up to my ogas who sent my ogas. Do you understand? Because they didn't see the picture of Oyibo. Okay, I ran around, I went, and I had employed national photographers. I didn't even know the photographers were ranked. I actually brought in one of the, I think by that time there were about 4 national photographers. I employed one, brought him in from his home station to do the coverage. So the guy must be good at what he's doing now. He brought me 5 Ghana must go of photographs of the Abuja Carnival. I went through everything, looking for Igbo. What I found were Chinese. So I sent the picture of Chinese people, and I'm told that they are not Oyibo enough. And government had invested, as at that time, and I'm talking about the time of OBJ, not less than 800 million to get the carnival on ground. And I'm asking myself, for what? For Igbo. Am I making sense to you? It can be demoralizing. That's the point. All that we had done to promote the diversity, the beauty, the richness of our indigenous cultural manifestations amounted only to, where is the Oyibo? The same thing with medical reportage. But I have some good news though. In Nigeria, we're not doing badly. Maybe because I'm a child of the 2 sciences I talk about. My paternal grandma was a bone setter. My mother is an ancient nurse, probably 2nd generation of a modern medical trained whatever and all that, who fell shy of making a doctor because there was no money in the family to train her to be a doctor, so she settled for being a nurse. But she did well for herself. She established a hospital. She employed doctors to work for her. But my mom, when my youngest brother broke his leg, would not go to an orthopedic hospital. She took my brother to her mother-in-law, who healed my brother of his broken leg. So I grew up knowing that the 2 worlds are not isolated. That is my world. I grew up with seeing my mother when she had some patients. She would step out, go to the back of her hospital, come back with a herb, come back with a shrub, and do whatever magic that needed to be done. And the patients, all they want is health delivery at that point in time. So I grew up knowing that the incantations that are done by the Babalawo is not spiritual invocation or demonizing the process. No. It's all part of the healing. And I want to take all of you back to, I think that Time magazine was either in the late 70s or early 80s, that did a cover about the mumbo jumbo of African alternative medicine, where it was proven that the fact that the traditional healer will tell you to go to the burial ground at a particular fixed time of the day to go and pluck a particular herb has been scientifically tested by Yoyibo to show that within the, I beg no vex, I don't know the grammar, is it the etymology or the geography or the science of the plant, as at that hour, the potency is at its highest, at its peak. I just want to say that Oyibo will never speak for us. They don't have to. Because if they allow you to validate yourselves, their businesses will go down. COVID ought to have opened our eyes. I have a friend who is a professor of pharma, something, works with Nightbreed. And up till today, he's still being funded by all this World Health, blah, 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 because he kept pushing that there was sense in the African treatment for COVID.
Yeah.
Yes. And to date, we are still standing to hell with Bill Gates.
You see, I'm a child of those two worlds. My father was a traditional gynecologist. Anywhere in the village and surrounding villages, that a woman couldn't deliver, they looked for my father. 20 minutes after the old man went there, the baby would come out. There were three of us, his children, who were grown up at the time. And I started to be very interested in what he was doing. But you know, this education can really truncate certain interests. 1975, I went into the university. But I was still in conversation with him. I'll come home, most of my holidays, I'll be at home. 1980, we had a date. Now on this day, I want you to come to my house in Zaria. And I had prepared my agenda of asking a lot of questions. It was on that exact day that we proposed to meet. My father passed on. And I never got to ask him questions about those things, what herbs, how he composed them to make the baby come out. And that library disappeared with the knowledge. And that's what happens with most African communities. The libraries disappear. So I think the takeaway for most of us should be there are loads of knowledges in different terrains, and we need to harmonize those knowledges and integrate them for our own good. And I hope that this is what the fellows will do. And ADReF should also become open, be more open-minded to some of these discussions. And I think to look for grants all over. Because I'm sure there are grants that promote indigenous practices. It may be possible to look for those grants and push this agenda forward. Thank you very much, the panelists, and all the contributions from the floor. I hope we advance it.
Okay, thank you very much, Prof. and panelists. We have had a very interesting session, we guess, because we are talking about leveraging and prioritizing indigenous African knowledge and practices in the area of health. We are going to take just a short break, 5 minutes, and then we introduce the next session. And in that session, we are going to have a different panel. Now, what do health journalists have to do across borders? How do they collaborate and what are the priorities that they have to focus on as health journalists working together across borders. That's what we're going to have in the next session. Thank you very much.